Welcome to the deep dive. Today we're tackling a topic that can be, well, visually striking and sometimes concerning for pet owners.
Mm.
Those changes in their animal's skin and hair color we call depigmenting disorders.
Yeah.
Like a dog suddenly developing a patch of white fur, or
Yeah.
maybe a cat whose black nose starts to turn pink.
hmm
What's going on there?
Exactly. And what might look like just, a cosmetic thing can actually be a signal that something else is happening sort of beneath the surface.
Right.
The information we've gathered really shows us the wide range of possibilities behind these changes.
We've got a great collection of info here, digging into everything from the basic definitions all the way to how vets figure out what's causing them and what can be done. Our goal today is to really unpack this whole area, to understand what these disorders are, what could be triggering them, and what it might mean for their health.
Yeah, get those aha moments.
Yes, Lee, those moments where the underlying science kind of clicks. So let's dive in. When we talk about depigmentation, what exactly are we seeing?
Okay, so at its most basic, depigmentation is the loss of the normal color, right, in an animal's skin and or hair.
Okay.
And this happens because either the pigment isn't being produced like it should be, or the cells that make that pigment, we call them melanocytes, they've been damaged, or maybe they're just not there anymore.
So it's not just a gradual fading like an old photo.
Yeah.
It's an actual loss of the color-making bits.
Precisely.
And our sources give us some specific terms,
Yeah.
right? Like leukotrichia, poliosis, and leukoderma. What do those tell us?
Yeah, they're like specific addresses for where the color loss is happening. Leukotrichia is kind of the general term hair turning white anywhere on the body.
Okay.
Poliosis is more specific. Like you said, it means the hair on the head or the face is what's losing pigment.
Yeah.
And then leukoderma, that refers to the skin itself becoming white. And, knowing which of these we're seeing can actually be an early clue for a vet trying to figure things out.
That makes sense, like saying a light went out in the kitchen versus the whole house going dark. So if these melanocytes are the key, what causes them to stop working or, disappear? What's the why?
Well, the underlying reasons are quite varied, as our sources point out, but often it comes down to damage or destruction of those melanocytes.
Okay.
Think of it like this. These pigment-producing cells can be kind of sensitive. They can be harmed by things like toxins. Even some byproducts of making melanin itself can be harmful if they build up too much.
Really?
Yeah. And inflammation, the body's response to injury or infection, that can also release substances that mess with melanocytes.
Right.
And then in some cases, the animal's own immune system can mistakenly identify melanocytes as like foreign invaders.
Oh, autoimmune.
Exactly. It produces what we call autoantibodies to attack them. It's like friendly fire.
Okay.
And then there are also things that can just directly block the pigment-making process itself, like putting a roadblock in front of the factory.
So it could be something attacking the color producer, something gumming up the works, or the body's own defenses getting confused.
Wow. Pretty much, yeah. That covers a lot of it.
And our sources mention that it's important to know if the depigmentation is the first thing you see, or if it shows up after the skin was already inflamed. Why does that timing matter?
That's a really good point. If the color loss is the first thing you notice, like a dog suddenly gets white patches, no redness, no irritation beforehand,
Yeah.
it might point towards something like vitiligo, where the pigment cells are specifically targeted.
Huh.
But if you see red, inflamed skin first, and then the color fades in those areas, well, that suggests the depigmentation might be a consequence of that inflammation.
Like collateral damage.
Exactly, like the damage from the fire leaving behind a discolored patch. So that timing can really help vets narrow down their list of potential suspects.
Okay, so we're seeing these changes on the surface, but which body systems are typically involved? Is it just skin deed, so to speak?
Well, the most obvious changes are in the skin and, the hair follicles, which are part of the exocrine system. But we also need to think about the eyes sometimes.
The eyes.
Yeah, in some of these conditions, the same type of pigment-producing cells that are affected in the skin are also found in the eye. So the eyes can get involved too. We'll touch on a specific example a bit later on.
Interesting. Okay. Now, this might sound a bit strange, but can where an animal lives actually have an impact
Right.
geographically?
Oh, absolutely. Our sources point out that conditions like discoid lupus erythematosus DLE and pemphigus erythematosus PE, they're seen more often in areas that get a lot of ultraviolet radiation, lots of sun.
Ah, so like high altitude or sunny climates.
Exactly. Think of it like how sunburn affects us, right? It seems that in animals prone to these conditions, that sun exposure can either trigger the problem or definitely make it worse. So yeah, geography can play a role.
That's a really practical connection. Now, let's get to something I know many listeners will be thinking about. Are there specific breeds of dogs or cats that are just more likely to experience these things? Is my pet at higher risk just because of their breed?
That's a very important question, yeah. And the answer is yes, definitely. There are breeds that have a higher predisposition to certain depigmenting conditions.
Okay.
For instance, German Shepherd dogs seem to be more prone to both mucocutaneous pyoderma, that's a skin infection around the lips and nose, and also systemic lupus erythematosus, SLE, which is a much more widespread autoimmune disease.
Okay, German Shepherds for those two. What else?
Well, DLE, that condition we just linked to UV light,
Oh,
also seen more often in collies, Shetland sheepdogs, German Shepherds again,
wow. Again?
and Siberian Huskies. And interestingly, there's some suggestion that female Siberian Huskies might be even more susceptible to DLE.
It's striking how the German Shepherd keeps popping up.
Uh-huh.
What about some other common breeds?
Okay, so for pemphigus foliaceus, another autoimmune skin issue, breeds like Chow Chows, Akitas, Cocker Spaniels, Dachshunds, and Labrador Retrievers seem to have a higher incidence.
Okay.
Uveo dermatologic syndrome, or UDS, that's the one we mentioned that can affect skin and eyes.
Right.
More common in Akitas, Samoyeds, and Siberian Huskies.
Akita, Samoyed, Husky.
Got it. And then when we talk about vitiligo, those characteristic patches of lost pigment. Quite a few breeds mentioned there. Belgian Tervuurens, German Shepherds, yet again, Doberman Pinschers, Rottweilers, German short-haired pointers, Old English sheepdogs, and Dachshunds.
That's a lot.
And in dogs, vitiligo often shows up pretty young, usually before they're 3 years old.
And cats. Any specific breeds?
Yes, for vitiligo in cats, Siamese seem to be more prone to developing it.
Okay. Siamese for vitiligo. This list is pretty expensive. What about those changes in nose color some dogs get? The ones that seem to fade in winter. Is that one of these disorders?
Yes, absolutely. Seasonal nasal hypopigmentation. It's a recognized condition, particularly in breeds like Siberian Huskies, Alaskan Malamutes, Yellow Labs, Golden Retrievers.
The snow nose.
Exactly, snow nose. It's usually just cosmetic, where the black nose fades to a lighter tan or pink, often in winter, and sometimes it comes back in summer. And we also see some conditions linked to age or other specific breeds, like epitheliotropic lymphoma, a type of skin cancer, more common in dogs over 10,
Right.
or proliferative arteritis of the nasal philtrum, that's a little groove in the nose associated with St. Bernards and giant schnauzers.
Wow. Specific.
Yeah. And don't forget things like periocular leukotrichia, white hair around the eyes in Siamese cats, and Chidiac-Higashi syndrome in Persian cats.
So a really diverse set of breeds and conditions. Okay, so if someone at home is starting to notice some of these changes, what are the actual signs they might see? What should make them pay closer attention?
Well, the most direct signs are, as we've discussed, leukotrichia, the whitening hair, and leukoderma, the whitening skin.
White hair, white skin.
But our sources also mention a more subtle lightening, maybe where a previously dark area starts looking kind of grayish or even brownish.
Okay.
Other things to watch for include erythema, that's just redness of the skin.
Red.
And in more advanced cases, you might see erosions, which are like superficial breaks in the skin, or even ulcerations, which are deeper sores.
Okay, so white patches, letter color, redness, or any breaks in the skin, especially in those color-changed areas. Those are the key things.
Exactly.
So if an owner sees these signs, what's the broad range of potential underlying causes? We've hit on some, but what's the bigger picture?
Oh, the list is quite broad, which really highlights why a vet needs to do a thorough investigation,
Yeah.
It includes things we've already mentioned: mucocutaneous pyoderma, DLE, SLE, pemphigus foliaceus, pemphigus erythematosus, UDS.
Right, the autoimmune ones and infections,
But also things like contact hypersensitivity, where the skin reacts to something it's touching.
like the food bowl.
Could be. Or other things. Then there's vitiligo, seasonal nasal depigmentation, and even albinism. Though it's really crucial to remember albinism is a genetic absence of pigment from birth, not a loss of pigment later.
That's a super important distinction.
Right.
Not technically depigmentation.
Yeah.
What else is on that list?
Okay, we also need to consider Schnauzer gilding syndrome, that unique thing in mini schnauzers with the golden hairs.
Diet begilbing.
Endocrinopathies, hormonal imbalances that can sometimes affect pigment, drug reactions, erythema multiforme, which is a skin reaction with distinctive target-like lesions.
Go.
proliferative arteritis of the nasal philtrum, post-inflammatory depigmentation, where color is lost after something else resolves, and immune-mediated pigmentary incontinence, where the pigment basically leaks out of the cells.
Wow, it really underscores how many different rows can lead to a change in pigmentation.
Mm.
Are there any specific things that might make an animal more likely to develop these issues? Any, like, risk factors?
Yes, definitely. As we touched on earlier, sun exposure is a big one. It's a significant risk factor for triggering or worsening certain autoimmune conditions like DLE, SLE, and PE.
Okay, son. Makes sense.
Also, certain medications can, in some animals, trigger reactions like pemphigus foliaceus or erythema multiforme. So both environmental factors like sun and internal things like drug sensitivities can definitely increase the risk.
Okay, so if a vet is faced with a pet showing these signs, how do they start to unravel this puzzle? Our sources talk a lot about differential diagnoses. What does that mean practically?
Yeah, differential diagnoses, think of it as the vet's mental checklist. It's all the possible conditions that could be causing the signs they're seeing, like a detective listing all the potential suspects.
Right.
And for each condition on that list, they'll look for specific clues to either rule it out or make it seem more likely.
Okay, so give us an example.
Okay, take mucocutaneous pyoderma. The depigmentation is usually secondary, meaning it comes later, and it happens in specific spots like the lips, around the nose, often with crusting, swelling, and importantly, it tends to get better with antibiotics. That helps distinguish it from something like, say, nasal solar dermatitis, sunburn on the nose, where the color loss is also later, but it's clearly linked to sun, and antibiotics won't really do much.
Gotcha. And how do they tell apart those lupus conditions? DLE and SLE. They sound like they could overlap.
They can be tricky, you're right. A key difference often is whether the color loss is the primary issue or if it follows other signs. In DLE, the depigmentation usually nose, eyelids, lips is often the first and most noticeable thing, and sun makes it worse. A specific test, direct immunofluorescence, looks for immune proteins in a skin biopsy, and it'll often be positive right at the basement membrane, kind of the junction layer.
Okay, DLE is more localized, primary depigmentation.
Often, yeah. SLE, on the other hand, is systemic lupus. It affects multiple body systems. So while it can cause depigmentation, you'll often see other signs too, maybe joint pain, kidney problems, fever.
Bigger picture issues.
Exactly. And a blood test looking for anti-nuclear antibodies, ANA, is often positive in SLE. Plus, you'd likely see that positive direct immunofluorescence too, similar to DLE.
So it's like looking for a combo of clues, location, other symptoms, specific test results. What about distinguishing between the different types of pemphigus, PF and PE?
Right. Another pair that needs sorting out. Pemphigus foliaceus, PF, typically shows secondary depigmentation. It often appears after other skin issues like crusts or pustules, especially face, ears, foot pads.
Okay, follows the inflammation.
Usually.
Yeah.
And if a vet looks at a sample under the microscope cytology, they might see characteristic acantholytic cells. Those are skin cells that have lost their connections. And that direct immunofluorescence test shows immune deposits between the skin cells in the upper layers.
Okay, and PE, pemphigus erythematosus.
PE is interesting because it can have really striking primary depigmentation, often on the face and nose, that can even show up before other skin lesions.
Oh, okay, so color loss first sometimes.
Sometimes, yeah. Like DLE, it's often made worse by sun. But with PE, that direct immunofluorescence test can show deposits both at that basement membrane level, like DLE, and between the cells, like PF. It's kind of a mix.
A mix, okay.
And sometimes the ANA blood test can be positive in PE, too.
Wow, these details are crucial for telling them apart. It really shows how much vets have to consider. What about UDS versus vitiligo? How are those distinguished?
Okay, uveodermatologic syndrome, UDS, that has that primary depigmentation, but the absolute key feature is the eye involvement, specifically uveitis, which is inflammation inside the eye.
The eye connection again.
Yes, and that often comes before the skin changes, so you might see color loss and inflammation on the nose, lips, eyelids, plus significant whitening of the hair coliosis.
Okay, UDS, skin plus eyes, usually eyes first.
Pretty much. Vitiligo, in contrast, is primarily just loss of pigment in patches macular depigmentation without inflammation in those spots.
No redness, no sores?
Typically not, no. It can affect the nose, lips, eyelids, foot pads, even the nails. Sometimes the hair turns white too, but you don't get the eye problems like uveitis that you see with UDS.
Okay, that's a clear difference. Our sources even mentioned some really uncommon things, like a reaction to a pet's food bowl. That sounds surprising.
It can be. It's not common, but yeah. Plastic or rubber dishes can sometimes cause a contact dermatitis, right, where they touch the muzzle and lips.
Hmm.
This can lead to redness and then maybe some secondary pigment loss.
Huh.
But usually, you won't see the ulcerations or significant crusting like you might with autoimmune diseases. And there's often a clear history, oh yeah, he eats out of that plastic bowl.
That's a good reminder that sometimes the simplest explanation is worth checking.
Absolutely. Always consider the basics.
And of course, we have those seasonal nose changes
Right.
and true albinism to keep separate, too.
Exactly. Seasonal nasal hypopigmentation is usually just that temporary fading, maybe gets later tan or pink. Albinism is lifelong, complete lack of pigment from birth. And then there's that whole host of others, schnauzer gilding, hormonal issues, drug reactions, even fungal stuff like ringworm, each with their own potential patterns and associated
It
signs.
sounds like putting all the pieces together, the breed, the location, the pattern, other symptoms, test results, is absolutely crucial.
It really is. It's detective work.
Speaking of tests, we've mentioned blood tests like ANA and that immunofluorescence test. What other lab work might be involved?
Well, routine blood work and urinalysis are often surprisingly normal in many of these primary depigmenting disorders.
Oh, right.
But they can provide supporting evidence sometimes. Like in SLE, you might see signs of anemia or kidney issues on the blood work or urinalysis.
Right.
In those Persian cats with Chidiakigashi syndrome, you'd look for specific abnormalities in their blood cells. In collies with cyclic neutropenia, you see those characteristic cycles in their white blood cell counts.
Gotcha.
And yeah, fungal cultures to rule out ringworm, and that ANA test is a key one for suspected SLE.
So blood tests can offer clues, but it seems like looking directly at the affected skin is often where the real answers lie.
Absolutely. More direct examination is usually needed. Cytology, looking at cells scraped or pressed from the skin surface under a microscope, that can be helpful. You might spot those acantholytic cells in pemphigus or maybe abnormal lymphocytes if it's lymphoma. If there's joint pain suggesting SLE, a vet might do a joint tap to analyze the fluid. For suspected UDS, a thorough eye exam by a veterinary ophthalmologist is critical to look for that uveitis.
Okay.
And that direct immunofluorescence test on a skin biopsy, we keep mentioning it because it's really valuable for identifying those specific immune protein deposits, the hallmarks of several autoimmune conditions like DLE, SLE, PE, and PF.
Right.
But honestly, for many of these disorders, the gold standard for diagnosis is still a skin biopsy sent to a pathologist.
And when the pathologist looks at that biopsy under their microscope, what specific things are they looking for? What are some of those key pathologic findings?
The microscopic findings can be really telling. For example, in DLE, SLE, and UDS, they often see a pattern called interface dermatitis inflammation right at the junction between the epidermis and dermis.
Okay, interface dermatitis.
Pigmentary incontinence. That sounds dramatic, but it just means the melanin pigment has leaked out of the pigment cells and into the deeper skin layers. You see that in DLE and PE.
Leaky pigment. Got it.
Those intraepidermal pustules with acantholysis, little pus pockets within the top skin layer where cells have separated, those point strongly towards PF and PE.
Right, the pemphigus types.
In conditions like vitiligo, UDS, seasonal nasal hypopigmentation, Schnauzer gilding, the pathologist will often just see less melanin than normal, a finding called hypomelanosis.
Just less pigment.
Exactly. Cell death of the main skin cells, the keratinocytes, that's called apoptosis, can be a clue for drug reactions or erythema multiforme.
Okay.
A specific proliferation, like an overgrowth, of cells in the walls of small arteries in the skin could indicate that proliferative arteritis. And of course, seeing infiltration by abnormal lymphocytes would point towards epitheliotropic lymphoma.
It's incredible how much information is packed into a tiny piece of skin. So once a vet has reached a diagnosis, what are the general approaches to treatment?
Treatment really depends on the underlying cause. For most conditions, treatment is outpatient, done at home.
Okay.
But severe cases of SLE or erythema multiforme or lymphoma might need hospitalization, more intensive care. A general recommendation for several of them, especially DLE, SLE, PE, is minimize sun exposure. Crucial.
Makes sense, given the UV link.
Yeah.
Mm.
For the autoimmune diseases, SLE, PF, PE, immunosuppressive medications are often the mainstay, trying to calm down that overactive immune response.
Okay.
If it's a contact allergy, obviously the key is identify and avoid whatever's causing it.
Like the plastic bowl.
Exactly. Switch to ceramic or stainless steel, problem solved hopefully. For any depigmented areas exposed to sun, using a pet-safe sunscreen SPF 30 or higher, UVA UVB protection is often recommended.
Good tip.
If UDS is diagnosed, getting a veterinary ophthalmologist involved is essential to manage the eye inflammation.
Right, protect the vision.
Absolutely. And of course, if there's an underlying infection like pyoderma or ringworm, you treat that with appropriate antibiotics or antifungals.
Now, there's specific medications that are commonly used and drugs of choice?
Yes, there are some common protocols. For SLE, vets often use corticosteroids like prednisolone or dexamethasone, frequently combined with another immunosuppressant, maybe azathioprine in dogs or chlorambucil in cats.
Okay.
For PE and sometimes DLE, especially milder cases, a combination of the antibiotic tetracycline and niacinamide, which is a B vitamin, is sometimes tried. Dosages are specific based on weight. Topical corticosteroids, creams, or ointments applied directly to the lesions are also used a lot for PE and DLE.
What about things like vitiligo or the seasonal nose fading?
Yeah, unfortunately for conditions like vitiligo and seasonal nasal hypopigmentation, which are usually just cosmetic, there's typically no medical treatment needed or effective.
Okay. And lymphoma?
Lymphoma has various chemotherapy protocols, really depends on the specific type and stage. That's a whole other complex area.
Are there any really important warnings or side effects owners should know about with these meds? Contraindications?
Yes, absolutely critical. Azathioprine, used in dogs for SLE. Should never be given to cats. It can cause severe bone marrow suppression, which can be fatal. Huge contraindication.
Wow, okay. Azathioprine and O for cats, got it.
Definitely. And something like ketoconazole, an antifungal, sometimes used if there's secondary infection. It's good to know it can occasionally cause hair lightening, plus potential for elevated liver enzymes or GI upset. Just things to monitor.
Okay. What about alternative drugs if the first choices don't work or cause problems?
Yeah, there are options. Cyclosporine in a modified form is another potent immunosuppressant used for various autoimmune skin diseases.
Okay.
And there are topical options too, like tacrolimus gel or pimecrolimus cream. These are non-steroidal immunosuppressants applied directly to skin lesions. They can be good alternatives or additions to topical steroids.
Any tips for using those?
Well, they can sometimes cause a bit of stinging when first applied. And it's important the animal doesn't lick them off, so applying them right before feeding or a walk or using an Elizabethan collar for a bit might be needed. Wearing gloves is a good idea too.
Good practical advice. So once treatment starts, what's the follow-up like? And are there potential long-term complications?
Monitoring really varies depending on the specific disease and the treatment. Regular vet checkups are usually essential, though, to see how the pet's responding and watch for any side effects from medications, especially the immunosuppressants.
Makes sense.
As for long-term complications, well, those depigmented areas are definitely more prone to sunburn.
Right.
There might be a slightly increased risk over the long term of developing squamous cell carcinoma, a type of skin cancer, in areas with chronic sun damage, especially related to conditions like DLE.
Okay, skin cancer risk.
It's something to be aware of. And in really severe cases of SLE, there can sometimes be scarring left behind from bad skin lesions.
This has been a truly in-depth exploration. It's fascinating and maybe a little sobering to realize just how many different underlying issues can show up as just a change in skin or hair color.
That's absolutely right. And while some of these conditions, like the seasonal nose thing or vitiligo, are primarily cosmetic and might not really impact the animal's overall health,
Yeah.
others can definitely be signs of more serious systemic illnesses like SLE or lymphoma. It really highlights why it's so important to get things checked out by a vet. If you notice unusual pigment changes, get that accurate diagnosis and the right care.
Absolutely. And hopefully this detailed discussion, especially getting into how vets differentiate these things and the sheer range of causes, will empower you, our listener, to be more informed and, proactive in discussing any changes you see in your own animals with your vet team.
Indeed, and it really makes you think, doesn't it, about all the complex factors, the immune system, genetics, the environment, all interacting just to maintain normal pigment. It makes you wonder what other, maybe even more subtle changes in our pets might be clues to these kinds of intricate internal processes going on.